Ladies and gentlemen, are you ready for another show of Heal Thyself? Because I am hyped up, ready to deliver some good information to you, ready to review some products, ready to get in a bomb guest, ready to drop some bombs, ready to go on with it. So without further ado, let's just get right to the show. I don't know how I didn't make this a show from day one. Constipation, man. All right, listen, if you don't think you're constipated, then that's one thing. Okay. But if you're constipated and you know it and you're not going day to day, that's a big issue, right? So we need to speak about constipation because we need to talk about pooping. If I could do a whole episode on pooping, it would be on pooping. But for us, we have to understand the implications of what happens when we're constipated, all right? So about 12 to 19% of people suffer from constipation. That's too much already, right? It's a symptom. It's not a disease. Constipation always has an underlying root cause to it. More women than men, actually about 3 times more. And you definitely see this in an older population, 65 and over. Non-whites especially are ones that are prone to constipation. Other risk factors, obesity, sedentary life. I mean, that's for sure. I mean, that's an obvious one, right? You're not moving, nothing else is moving within you. Pregnancy, for sure. I know that there's many women listening to the show that may have experienced constipation or have, and I will be speaking a little bit about some recommendations too. So constipation means that you have 3 bowel movements per week, right? And actually, there's some doctors out there that'll say this is normal, this is good, this is fine. It's not normal. You can't be having 3 bowel movements per week. That is not normal. Take my word for it. Please do not have 3 bowel movements per week. And if you do, you got to seek a doctor to help you start moving things around, all right? So for me, if you're not going daily, which is optimal, or actually optimal is actually going after every single meal, that'd be great. That's not really the regular for a lot of the patients that I get, or for what I hear. But if you ain't pooping, you ain't healthy, period. All right, so the most common type of constipation is something called atonic constipation. That's just when the colon is lazy. It's just blah. It's not moving, right? All that poop is in your colon. It's supposed to move out, but the colon is like blah. It's like a wet noodle, wet spaghetti noodle. Whereas spastic one, that's the opposite one. It's the less common type of constipation, but that's when the colon is super spastic, so it's not letting anything through. Right? So it's 2 sides of the spectrum. Incidence of it has been steadily rising since 1993. And the largest rise has been seen in children. Top 5 most common reasons for outpatient visits in GI physicians is children with constipation, believe it or not. Now, I have a lot of theories to that. For sure, if your child has constipation, you got to look at different factors. None of the short end being food, right? And getting them off dairy. That's going to be major. All right. So not only are we talking about frequency of going to the bathroom, but you got to talk about quality, right? Got to talk about quality. If it's difficult to pass a stool, it's likely a dietary root cause. Stools should never sink all the way to the bottom. They should actually partially float. If it's not floating, that may be a sign that you're not getting enough plant food. Or if, conversely saying, if it's not breaking down fat and it's floating, but it's greasy and clay colored and it's cloudy and it's foul smelling, then you're likely not breaking down fat and it might be an issue with your digestive system upstream. So again, you got to pay attention to your poop, really. There's something called a Bristol stool chart, which you all can Google. If you're driving, whenever you pull over, you can look at it. It's called the Bristol stool chart, and it has types 1 through 7 for poop, right? And you'll see type 1 is like small little pellets. That's like Skittles. Whereas type 2 or 3 are more like rock hard, like Snickers, formed, but like Snickers. And then type 4 is something that is more optimal, like a snake. Right? That's the type 4. Now, as you go up past type 4, you get 5, 6, and 7, which is progressively being watered down in something like diarrhea, now on the other end of the spectrum. So if you're falling within types 1, types 2, types 3, consider yourself constipated. Okay, so I had this friend of mine, her niece was like 1, struggling to pass a stool, and 2, it was like little Skittles. So type 1 on the Bristol stool chart. And I went over the diet immediately, and this girl was having lots of cheese and lots of milk. Never again did she have Skittle poop since she removed the milk from her diet, right? Which is a major cause of constipation, especially in children. And this girl was like kind of scared of her poops now because they were all formed and looking priceless. But she was used to the Skittle poops because that's what she thought it was to pass a bowel. Anyway, digressing. So some causes, some but not limited to diet. Of course, diet. Poor nutrition, under eating. If you're fasting a long time, you ain't going to be passing a lot of bowels. for sure. Inadequate hydration, think about it. The days that you are really dehydrated, how well your stools are coming. But fiber. How many times do I talk about fiber on the show? It's so important because fiber is the macronutrient. It is the nutrient that we need in our body every day. The RDA recommendation is absurd to me. 20 to 25, that is absurd. That is way too low. Typically, the children and American adults get about 10 to 15 grams of dietary fiber a day. That's crazy. They don't even hit the absurdly low level. Really, that's about 2 to 4 times less. I even say about 70 grams and over is optimal for people to be eating fiber. So fiber is so important. Now, there are some contraindications for having a high fiber diet, so make sure you check with your doctor, okay? But remember, the RDA is not a recommendation that is based on keeping you healthy. The RDA recommendation of 20 to 25 grams is the average for just safety, right? Not optimization, average for just safety. And that goes the same for vitamins, right? The dosage they give you is just so you don't develop a deficiency disease. What are some other dietary causes? Too much meat, too many simple carbs. USDA estimates that we consume about 150 pounds of sugar per year, and sugar in itself will slow up the transit time. Imagine that then you have with too little fiber, or something like a carnivore diet where they're just eating meat and no fiber, which is really worrisome for me in itself and what it does to the microbiome. But you ain't gonna be pooping regularly if you're eating like that. So remember, this is why I always talk about plant food, because that fiber macronutrient is so important. Other causes, there's some metabolic causes like electrolyte imbalances for sure. That causes osmotic changes. So you're not getting enough or too little water into your stool. Kidney issues for sure, diabetes, pregnancy, as I mentioned. We also see this very common in drugs, medications, opioid-induced. I've seen some of the worst constipation in my life at the cancer hospital I worked at because these folks were on opioids for their pain after surgery. And yeah, it's really horrible. So I feel for that. And again, you have to work with someone who is specializing in this that can help you really pass your bowels. But it's a big obstacle when it comes to the opioids. What else? Antacids. I have a whole show on that. Go back and check it. Antidepressants, barium sulfate, diuretics, hypotensive, contraceptives certainly can cause constipation. Laxative. Well, here's the problem with laxative. Your body gets used to it. They're refractory, right? It builds up a tolerance in the body, and now you're relying on outside stimulus to pass a bowel. So it can be a big issue if you're using laxative over and over and over. What else? Hormonal, for sure. If you have thyroid issues, particularly hypothyroid, constipation is one of the main indicators of hypothyroid in the whole picture. Constipation in folks with high amounts of something called beta-glucuronidase, right? And this goes back to the show with Carrie Jones where we spoke about estrogen metabolism, right? In the microbiome, there's a portion of it called the estrobolome, right? That's where the estrogen is basically being removed. But certain species have high amounts or high level of beta-glucuronidase. And you can actually check your level of beta-glucuronidase on a poop test. And what that enzyme basically does is when your liver conjugates estrogen, puts it in the poop, transit, the whole point is for you to poop out the excess estrogen. But what happens is beta-glucuronidase, the way that Carrie Jones illustrated it, is like having a present with a bow. Beta-glucuronidase opens up that bow and releases all of that unconjugated or deconjugated estrogen. And it goes back to in its active form, right back in the body. And then it's increasing excess estrogen into the body, which is a major concern for hormonal cancers, but certainly anyone with hormonal issues. Or just in general, right? We don't want excess estrogen in our body, particularly because we're exposed to so much estrogen from the outside as a whole anyway. So it's very important if you have breast cancer or any sort of hormonal cancers or any hormonal issues to be pooping every single day. Okay, so what else? Psychiatric, neurological for sure, neurodegenerative diseases, multiple sclerosis, Parkinson's, depression, psychosis, anxiety, all these things can affect, right? Because your brain and your nerves are connected, and those nerves are connected to your whole digestive system, particularly in the colon. They can cause a spastic colon or atonic colon. For sure, the health of your gut is going to be reflected. This is why actually probiotics do help some people when it comes to constipation. Dysbiosis, or the imbalance of good bacteria to bad bacteria, is going to be causing a lot of issues with your bowel movements, impactions for sure, irritable bowel, colon cancers for sure, or a family history of polyps, or if you have a family history of colon cancer, ulcerative colitis, you definitely need to be getting checked, okay? Especially if you start pooping blood. All right, so how do you manage this? What are some things that we need to keep in mind? your basics, fruits and veggies daily, period. I say this all the time for a reason. I mentioned the fiber was so important, and we're not talking about Metamucil, right? We're talking about food fiber, right? You want water-soluble, fiber-rich foods like fruits and vegetables. That's going to help your constipation, and you want to incorporate those things like yesterday if you haven't started, okay? Nuts and seeds are really the next most important thing, and then whole grains. So really, having a lot of plant-rich, plant-centric foods in your diet to help you with constipation. Avoid foods that are notorious for constipation. All right, so what are those? Dairy, really big. Again, as I said, for infants and toddlers, older children, teens, you must look at dairy if they have constipation. And if your pediatrician is not telling you this, then that's a problem. Alcohol, for gluten, actually, gluten for non-celiac gluten sensitivity or even folks with IBS, gluten can actually be a major cause of constipation for folks. So again, you can get tested for this. Processed grains, meat-heavy diets with low fiber for sure, fried and fast foods, duh. Actually, interestingly enough, persimmons, because they're so astringent, can actually cause constipation. And they're really actually one of my favorite fruits, to believe it or not. Dried plums or prunes actually have been shown in studies to help. That's why that's like old wives stuff. But yeah, plum juice does work, or dried plums or prunes. Coffee can help with some people. Supplement-wise, you may want to look at prebiotics. Inulin can be helpful as a powder, not only to move the bowel, but also help build normal flora. It helps feed bifidobacterium. So usually that has minimal side effects, but remember, this is not a recommendation. You got to talk to your doctor first. Fiber supplements should be more for adults, not for kids. Try getting the kids on the food first, always drinking lots of water. I always say half your body weight in ounces of water. You got to be drinking nonstop. Water is life, and it's a big pillar. Fermented foods or even probiotics have been shown to be helpful. I've actually seen a lot of different probiotics, even lower quality ones that people were taking, help with bowel movements. But again, talk to your doctor if you're about to supplement. Now, if it's really severe, your doctor, your naturopathic doctor or functional doctor may prescribe some sort of short-term laxative, right? That's a last resort, and it needs to be done with a professional. But another intervention that for me I feel more comfortable with is even magnesium, right? I did a whole show in the past. Go to the magnesium show and find out which is the best form for you for constipation. But magnesium acts as an osmotic laxative, so it pulls that water to soften that stool so you can be pooping more regularly, all right? You got to move every single day, and if you have the urge to go to the bathroom, go. Don't resist it, right? You don't want to train your nerves to do something that they're not supposed to be doing. Again, talk to your doc. There's things like bitters, the laxative I mentioned. If you have spasmolytic or the spastic colon, that type of constipation, then there's spasmolytic herbs that help release that tone so you can go to the bathroom. Possibly an enema, and squatty potty helps people actually. I've heard many good things about it. So there you go, constipation, you gotta be pooping, take home. I gave you some good advice, good things that you can implement immediately. There's a lot of good books out there. There's a natural approach to gastroenterology, which is good for any of the students out there by Eric Yarnell. And yeah, I hope this portion of the podcast helped. Let's get to the product review. I'm really excited to talk about this. All right, product review time. One of my biggest pet peeves is when I walk into someone's home and it smells like synthetic chemicals, synthetic candles, synthetic plugins, synthetic air sprays, synthetic perfumes. It drives me crazy because I'm very sensitive to it, right? For me, it manifests as asthma. My respiratory tract will, rightfully so, close up, and it sucks. But a lot of other people have different symptoms. I know someone particularly who gets headaches every time they're exposed to it. So what I want to do is talk about plugins, right? So in the 90s, they got really popular. There's so many commercials, I remember them. And basically what it does is it utilizes heat to start aromatizing that synthetic or chemical scent, right? That's what moves it. That toxic scent is being pushed by heat when you plug it in. But it's a surefire way to disrupt your hormones. Whether it's your children's or your dog's, go get a plug-in. And biggest pet peeve is when really that I know that these things are causing damage to people's hormones, their immune system, their nervous system, and they're there. They're all the time. So education is really important around how toxic this stuff is, and I'm about to get into it. It's nauseating, gives me a headache. So cumulatively, it is making your family sick. And if you have a child who is experiencing allergies, you may want to think about this first before you think about the birch tree that's outside, okay? So not only does these type of things disrupt hormones, and it's not just the plugins, it's also these air sprays too. Not only do they disrupt hormones, but they're known to cause, as I said, hormonal abnormalities, but birth defects, reproductive problems, right? So according to a study done by the Natural Resource Defense Council, they did an independent study. They looked at 14 of the most popular air fresheners, and they found 86% of them had phthalates. And phthalates are really, really concerning, right? We talk about hormone disruptors. They're really up on the list. So it's not just the scented ones too. It was also the unscented ones. How? Well, they come aromatically. We breathe them in, but also these particles land on our skin and they're absorbed. Actually, the state of California notes that 5 types of phthalates, including the ones that were found in these plugins, and 86% of them are known to cause birth defects and reproductive harm in the state of California. That's crazy. So we're recommended, actually this group that did the independent study, they recommended to avoid as a whole plugins or these aromatic sprays, and EPA should actually require testing for phthalates for every single one that comes into the market, because that's not happening. So I don't have the ones that played the worst on this study, but the worst ones were the Walmart air fresheners. That was the worst on the list. There's all different types of all the ones coming from Walmart. But also, the ones that had moderate levels of phthalates were the Glade plug-in and some of the Febreze and the Airwicks. Okay, so I went to, where did I get this? There's a place called Vons here in Los Angeles. Might be out of here, I don't know. But it's sort of like a conventional supermarket. It's not like a Whole Foods. And I got these, and I went with my friend who's a medical student, and we walked into the aisle, and she's like, oh my God, I'm getting a headache already. And I believe it because my biggest pet peeve is walking into anywhere that smells like the candle section at Target. It's the worst because you can smell how synthetic it is. That's, to me, is like a big pet peeve. Anyway, I said that before. Environmental Working Group, of course, they're the ones who do the best work when it comes to all of this. And I'm going to start with the worst of the worst. This is the Glade plugin that I bought. This is the Clean Linen plugin. This scored an F, right? Really, really low, an F. And this is because of poor disclosure, high volatile organic compounds, right? All that stuff that is really causing tons and tons of stress to the body for you, your children, your dog, your cat, your hamster, whatever it is. And it may contain ingredients with potential for cancer, developmental, endocrine, reproductive effects, and damage to the DNA. So why? Why does anyone even still buy this? Because they don't know. But guess what? Now you know if you are buying it. And if you have it, throw it away. Get it on video. Tag me in it and throw it away. Okay? Because this doesn't deserve to be in a household, period. Okay, the next worst is the Airwick. This scored a D. And the Airwick, again, poor disclosure, may contain ingredients with potential for skin irritation, allergies, damage, and it also has a lot of damage to the environment, aquatic damage. But really, this is what we need to look for: skin irritations, allergies, developmental and reproductive issues, cancer. You see, one of the things that I always think about is childhood cancer, right? Certainly, it's not because they worked a 9 to 5 and were stressed all their life, but why are children developing cancer? Well, it really starts with the mom and the dad early on in their health. Are they being exposed? What is their toxic load? Or as my friend Dr. Ralph Esposito calls it, is allostatic load. How much are we building up to where our homeostatic mechanisms, right? Our balance, how much are we building up so our balance is disrupted? Because once that cup overflows, there's a big issue. We got to bring it back. It's hard to bring it back after it overflows. But stuff like this adds to your allostatic load every single day. You plug this in, you're not going to get cancer that day. But I promise you, if this is part of your life, you're predisposing yourself and your children. Okay, the next one, I swear to God, there should be lawsuits against these companies. This is just ridiculous that this is sold. But that's how the industry is right now. This is the Glade spray over here, Lemon Fresh Glade spray. I remember my mom used to use this stuff sometimes throughout the house. Little did we know, right? So Glade spray, there was poor disclosure, may contain ingredients with potential for developmental, endocrine, reproductive issues, cancer, damage to the DNA. Just from a spray? Yeah, from a spray for sure. And you know, the most at risk are the children or older folks. So this is crap. I'm going to give you other options, but this is crap. And then Febreze Air, this is Hawaiian Aloha, got a D too, for almost the same reasons as Glade: endocrine issues, reproductive issues, environmental damage, skin issues. And it's really because it has something called a deodorizing agent. That's a big one. It's predisposing you to skin irritations, allergies, damage, reproductive effects. The same story, but also has fragrance. A lot of these just have that ambiguous word, that fragrance, where we don't know how many chemicals are in there, but certainly is causing major issues to the body, okay? All right, so you know how much I dislike these air fresheners and plugins. So what are some other options? Well, there's a diffuser, an essential oil diffuser, but it depends on the essential oil it's in there. Now, a few years ago, there's a study that came out about lavender, tea tree oil, essential oils leading to hormonal disruption in prepubescent boys and causing gynecomastia, breast in these boys. Now, when you look at the study, and it was in the New England Journal of Medicine, which is very prestigious, right? New England Journal of Medicine, very prestigious regardless. What I saw was a case report, so very weak study, hard to add exact causation, but they tell me nothing about the brand. They tell me nothing about the quality of essential oils, right? Now, essential oils are something that can be, I'm going to do a whole show on it too, I promise, but are something that can be tampered and adulterated with big time, right? From sourcing to processing to packaging, from everything. So you got to get good quality essential oils. Now, with that said, I would proceed with caution. If you're diffusing things like cedarwood, fir, grapefruit, lavender, lemon, spearmint, tangerine, eucalyptus, peppermint, then you may, or tea tree, then you may be predisposing yourself, because some of these have compounds that can irritate the respiratory tract, right? So for some folks, not all. But I would really highly recommend to find a company that uses the utmost potential for cleaning and having the highest quality products, right? So then we're thinking, you see, I haven't researched enough into the companies. I hear doTERRA, Young Living are good. Even Mountain Rose, I think it's called. But I promise you I'll know them inside out. Regardless, you got to do proper research, get on the phone with people, find out, look at research, because if this is going to be part of your daily life, you want to make sure that it's the highest grade. Okay, and I will do, like I said, an essential oil show in the very near future, so I'll be doing a lot of the work for you. You can also get the diffuser sticks, which aren't actively making essential oils aromatic, that are the sticks that are staying in the oil, the little glasses. There's a lot of do-it-yourself stuff for home, right? Bustle had an article that I'll link on here, essential oils, but mixing with pine cones, orange and cinnamon water, Q-tips and different oils. You can do do-it-yourself gel air fresheners, baking soda in jars, different flowers like lilac and rosemary. So the bigger question is this: are you enjoying the synthetic smell, or are you masking a smell, right? If you're masking a smell and it's like a moldy smell, then I would really get to the root cause of the mold, because that can be causing bigger issues than these things. But if you want just a fresh smell, open your windows and add more of these do-it-yourself clean options, because it's day and night. And the whole point of this informed consent. If you're buying this, don't feel bad about it, but now you make a decision where you want to go with this. So with that said, that's the product review. I'm excited to get this special guest on here and talk some really, really important, interesting stuff that, for me, I never heard of until I met him. All right, everyone, today's special guest, this guy's so cool. We met at a party and we had a conversation, and it blew me away, and I said, I need you on my podcast ASAP. So finally, after a few months, we got him here. This is Kevin Rosenbloom. He's a biomechanist and orthotist. Never said those words in my life. We're going to find out what that means. Kevin.
Good to be here.
Was that a good intro?
Yeah, it was a great intro.
Are you satisfied?
Totally.
So, okay, what is an orthotist? I just said that. Can you just explain a little bit about what you do? Because I think what you do is awesome.
So an orthotist is someone who is in the same field as prosthetics. A lot of people are familiar with people who run that have an amputation and they have a prosthetic leg.
Yeah.
Okay. Or if you see a collar around the neck, that's pretty forefront and center. That's considered a brace. Or braces on the teeth, you go to an orthodontist. So an orthotist is someone who specializes in braces for the entire body. I have a specialty with lower extremity. Mm-hmm. So anything from the hip down. I have a further specialty as a Pedorthist. Mm-hmm. And then an intensive focus on overall biomechanics.
Okay, awesome.
Yeah.
And biomechanics meaning how the body functions, the bones, muscles, the joints, how they move, right?
Yeah, so there's basically historically two ways of looking at biomechanics in different specialties. One is the heart valve. Okay, so your heart opens and closes these different valves. That's like a whole area in itself. Not my specialty. The other biomechanical specialty is full body biomechanics, the way joints move, the way muscles move, bones move, how they react to different loads and stresses and forces. And which is really interesting in functional medicine is there's kind of like a new development at a cellular level. So cellular biomechanics, loads and strains on your cells, okay? Gravity, movement, strains, all these types of things that you do when you move through your environment. Does that make sense?
Yeah, and I know you're passionate about understanding how we react to our environment. So, and really interesting about the cells, because I do a lot of environmental medicine, so I see how it affects cells and how different chemicals do. It's really a big passion of mine. So, when you say as part of your work and how our environment affects us, you really focus on the lower extremities, right? That's knees, feet, right?
Yeah, exactly. And so my specialty kind of comes from focusing on surgery, actually, and backing out of finishing with a surgical program simply because I saw there was a big lack of the care that you could take to prevent surgery. When you go to a surgeon, very often it's an 85% success rate is essentially the consent that you're signing away for. And I saw a lot of surgeries that went south, so to speak. So if you can stop the root cause and go further upstream, at an orthopedic level, we can avoid hip replacements, knee replacements, neuromas, all sorts of different foot surgeries, all of these things. When you have a traumatic experience in a car accident, of course you need surgery, but when you have elective surgery or surgery from a pathology that's not responding to conservative care or taking pills, physical therapy, there's things that you can do, physical therapy, changing your environment, changing your behavior to address your aches and your pains and get you more comfortable and have a more functional body, if that makes sense.
Yeah, for sure. And you mentioned, knee replacements, hip replacements. Is it important now for us at our age, we're still young, right,
Yeah.
to make interventions? And if so, what type of interventions do we need to pay attention to?
Movement, I think, is the biggest takeaway in a word. And to really make sure that you're introducing kind of like a variety of healthy movements. Okay. The biggest thing is a good example that I tell patients is yoga. Okay. Yoga is an amazing activity to be involved with, but one way or another, even if they say, and I'm not a yoga expert, okay, I participate in it, but I'm by no means an expert. People always, or instructors are always telling me, this is your practice. This is your hour with yourself. It's kind of a spiritual thing. But then I see a lot of patients who have hurt themselves in yoga. And I call it competitive yoga. Okay, because you're in the back of the class and you're looking at the people in the front of the class, and they're putting themselves into these positions that are really difficult to get into. And you're pushing and you're pulling on your body and you're trying to get yourself into that position. In the front of the room, you've got a person who's doing these headstands and really flexible. And do you practice yoga yourself?
Yeah, I do. I've seen exactly what you're saying.
Yeah, and then the next thing you know, the guy in the or the girl in the back of the class has hurt themselves from trying to get into a position. It's like being 5 feet tall and wanting to dunk a basketball.
Yeah.
Sorry, you're just not going to be able to do it.
Yeah.
Or being 6'7" and trying to be on the gymnastics team. Yeah. You're just too tall. You're not going to be able to rotate around.
Right.
These are the mechanic realities of your genes and your phenotype that you're presented with, if that makes sense.
Yeah. So you mentioned yoga as a movement, right? Not the competitive yoga, which I know you're not a fan of, but just yoga as movement. But are there other movements like what do you think about jogging, exercise, weightlifting?
Yeah. So, understanding who you are, okay, is something that I think we're kind of at the tip of the iceberg, or there's going to be in the next generation. I was having a conversation this morning with a new client in Florida, and recently graduated from med school, had a 4-year residency as a surgeon, but he's very into this functional medicine. He's very into new methods of treating patients and healthcare and avoiding surgery and this conservative care. And part of that is knowing who you are. So it's one thing to know how tall you are, okay, and it's one thing to know how much you weigh, but it's one thing to know how flexible you are. And sometimes your genes will mesh with your environment. You'll be flexible in one joint, but then you won't be so flexible in the next joint, okay? And that's something that we don't hear a lot about so much. So you have culture, you have basically different outside factors that'll put you into certain things, and you want to walk a certain way, as odd as that sounds,
right.
okay? Or you'll want to do a cool activity like play soccer, okay, because your friends are doing it. But you may not be so suited to play soccer. And the next thing you know, you've hurt yourself, when maybe you should be playing tennis, or maybe you should be, doing yoga instead.
Yeah.
Or maybe you should be skiing, or maybe you should be running. Or if you're a runner, maybe you shouldn't be running, okay? So knowing what your body is best at in its environment is kind of a takeaway. And it's not easy. And I think if you kind of look back at children when they're really young, you have a parent and you're essentially put into all sorts of different activities. And it's almost like throwing pickles at a wall. What does my child like to play? Okay. And the child may not like to do anything except play video games. Usually it's kind of because they don't feel successful with what they're doing. Right. But they feel successful at video games, or they feel successful in drawing or playing music or something like that. And so you size yourself up. Psychology, you're going to kind of look at the playing field, look at your friends, and if you're really good at playing soccer, you're going to be like, ooh, I like soccer. I'm like the best kid on the field. Or I have a couple buddies, we just dominate, we do really well. That's what goes on with the kid who's 5, 6, 7, 8, 9, 10 years old. By the time you're 13 or 14 years old, you've kind of like found your sport and you're pretty good at it. You're in high school, you kind of know where you're at. Does that kind of?
Yeah, it does. So you're saying having an awareness, or let's say, because there's a lot of parents who listen to the show, having an awareness of what your kids are good at, or what they prefer, or understanding the psychology behind that before they go into certain things, so as to not injure themselves. Is that what I'm hearing?
Yeah, exactly. You want to put a round peg in a round hole.
Yeah.
You want to do the activity that's built for your body. And having that awareness, and it's not easy. And it's something that's very new. So it's something that I'm intensively working on to give a guide and give an exam. So this exam is called Biomechanical Intelligence, and it essentially allows a clinician to measure a patient, and at the end of these measurements, consider it an X-ray or an MRI or a CT scan or a blood test. You get numbers and you get values, okay? And you essentially have a static picture, a snapshot. A biomechanical intelligence exam shows the joint articulations and the morphology, or the shape of your body, okay? So, for instance, there's a great statistic that if you are 203 centimeters tall and you have a wingspan of 203 centimeters, there's a 1 in 6 chance you're a professional basketball player.
That's
crazy.
Yeah.
So, and if you have a wingspan from middle finger to middle finger when you spread your arms, over 205 centimeters, there's a 1 in 3 chance you're a professional basketball player. Okay, so that's like a pretty good example. If you're 5 foot tall and you want to be a gymnast, sorry, you're too tall. You need to be 4 foot tall, 4'11", to get on the Olympic team.
Wow.
Okay, so these are like the elite athletes. Okay, but understanding what sport should my child play, that'd be really interesting.
Yeah, for sure. So as to prevent injuries or anything that could be even catastrophic in many ways to some kids.
Preventing injury, also for boosting self-esteem.
Yeah,
okay,
for sure, right?
Yeah.
I'm built to do this.
Yeah, exactly, and excelling really well in that sport.
Yeah, I personally was not good at football, but I was good at lacrosse, which was interesting, right? Like it's different. You're still running, but it's different points of contact, different movements, right?
Yeah.
It was really interesting to see that.
And I played lacrosse as well. I was not very good at it.
Yeah.
But offhand, the list of things we have for lacrosse is basically eye-hand coordination.
Yeah.
Okay, being able to spot a small ball like that, put it in the pocket, is really important.
For sure.
Okay, and reacting. Yeah. And that baseball is that way.
Yeah, exactly. Whereas football is less so, right? Especially if you're not even touching the ball, right? And you're just hitting people. But I think it's really interesting that you're starting to bring out this conversation, because we sort of like want to do a one size fits all. They're like, okay, let's do this. I should be playing this. This is what all my friends are doing, right? It messes up your self-esteem.
Totally.
Right?
Yeah, totally.
And I'm sure that's happened to a lot of people. So you said it's pretty difficult to really identify, like, biomechanically what is made for you. Really, we have measurements like height and weight, but and flexibility, right? So I guess people need to be more in touch with their bodies to understand, maybe I'm not as flexible. Even if I do yoga for like a year, I'm not as flexible as, my best friend. Maybe we're built to do different things, exercise-wise or regimens.
Right.
Right. So how does this tie in? Because I know one big passion of yours is like our whole lineage of our history, which really blew my mind when we spoke about it. How do you tie this in? Because is it how we were walking throughout our history, evolutionarily, how we changed? Like, let's go into that, because, man, that's some good stuff.
Yeah, and I can talk about this for a really long time.
That's why I wanted to get into it now.
Yeah, and I'll try and make this brief. Where, if when I look at a patient, I look back at about 3.5 billion years of evolution, because it's safe to say that we've all kind of come from a single cell, okay? And then when you get to the sea squirts, okay, about 500 million years ago, which are our relatives, and you look at primates, which kind of our ancestors essentially, you have to be cautious when I say ancestors, okay? Our relatives, meaning cousins, figure 65 million years ago. This is right around when the dinosaurs were extinct, okay? It took about 40 million years ago for the rodents that were underground during this massive extinction. There's like 6 massive extinctions, okay, on Earth. And so these big catastrophic events. And one of the hypotheses, or one of the theories, is essentially that there was this massive collision with something that came out of space, kind of around where Mexico is, around 265 million years ago, okay? And you've heard of this maybe?
Yeah, for sure. Okay. Yucatan Peninsula, yeah?
Yeah, exactly. So the mammals that were around, okay, went underground. So like rat tests in laboratories, how, scientists say, hey, we're very similar. People if you say, hey, we're testing rats or mice and things like that. Genetically, we're very close to these guys, okay? So it took about 20 million years for us to have a relative that was in a tree that had prehensile capabilities, which is the hands are gripping the tree trunks, okay? And then it took till about 8 million years ago when we had our primate ancestors coming out of the trees. You see the evolution of us walking on 4s, looks like a chimpanzee in this evolution graph or infograph, so to speak. And then they start walking upright, okay? And that happened anywhere from 8 million to about 6 million years ago, okay? So you have like this monkey-type foot situation, and you've got hips that have changed. And you basically have to look at this divergence evolution. So if a couple of people get together and they have, let's say, 5 kids, but there's a mutation with one of them where they've got a more efficient foot that it can walk longer and further and is able to gather more resources, more food, okay? And let's say the other one's they don't survive because they can't get enough food. And then the one that is able to walk further and longer and gather food is getting together with someone else who's able to have more success in gathering resources. And so as the climate has changed and as resources have changed, you have over hundreds of thousands of generations, essentially a selection of getting different presentations of your phenotype, right? Genetics change, and you're left with essentially all the way to us now, where about 200,000 years ago, okay, we went from walking upright. There's Australopithecus, which maybe you've heard of Lucy.
Yeah. Okay,
that's like a skeleton. That's one of the most famous skeletons. Most people have heard of Lucy. She was Australopithecus, and it was about hominid, which was about 2 million years ago, Homo erectus, and then you have Homo habilis, Homo heidelbergensis, in that order, before you get to Homo sapien. A cousin of ours is Homo neanderthal, which were kind of thinking this is a cousin of ours, coming off of Homo heidelbergensis. So there's a lot of different lineages that are out there that basically are being intensively studied. Okay, looking at fossil records, really all we have is bones left over. Okay, and it's something like 1 out of 1,000,000 is a statistic that I kind of agree with. Bones that are available actually turn into fossils. That's 1 out of 1,000,000 bones.
Wow.
So there's not too much out there. Okay, but there is a lot out there, and there's a lot that's being studied. And what's interesting, so forgive me, I'm going to bring this up to why this is relevant to us. So here we are as a species, and I just got back from South Africa, and I was at Pinnacle Point. And Pinnacle Point is one of these, one of 7 hotspots where there's a lot of activity. And when I say activity, that means there's essentially a lot of shells, a lot of bones from all sorts of different animals, and early Stone Age hand axes, meaning very evident in caves where there were our relatives, or I should say, at this point, 200,000 years ago, I can say our ancestors, Homo sapiens, that were hunting, gathering, a paleo-type diet, and had developed a very efficient mechanism from their hips down to their feet through many generations of mutations. Okay, it started to develop their brain, their hands, their facial characteristics, all the different things, very close to who we are today. So you have essentially modern history. You've got the agricultural revolution. These are like, going back, you have the cognitive revolution, all these different revolutions, okay, where there was advancement in Homo sapien cooperation. You have essentially overlap with the Neanderthals living at the same time of us, and all of a sudden all the Neanderthals were extinct. Why or how did that happen, okay? What's applicable to us today is that you have this incredible body that, if you understand the story of how we've kind of evolved over such a huge time span, okay, in such a short amount of time, in our lifetime, in your parents' or your grandparents' lifetime, are you in touch with your grandparents, your great-grandparents?
Dead, but
okay.
But I wish I was, yeah.
Okay, so you hear stories, you see it on Hollywood, you can read about these types of things, about what life was like. And so in the past, say 500 years, or even 2,000 years, life has changed so dramatically. And the most applicable thing to the lower extremity is the invention of the wheel. Okay, so think of the agricultural revolution. This is about 13 to 10,000 years ago when we started to plant and domesticate rather than gathering. It took about 4,000 years for us to stop taking camels, essentially, and bringing our bounty to the center of town to say, okay, let me pull something behind the camel, and you invented a wheel. So the oldest wheel we have is in like Mesopotamia. It's about 6,000 years old, and that's right about the time when we started to have roads built. And when roads were built, you're all of a sudden changing the ground that you're walking on. You have a substrate, okay?
Right.
So in the UK around 6,000 years ago, you have something that's called a corduroy road. So they took wood and they laid it down where it was muddy. So the wheel didn't get stuck in the ground. They just laid wood, branch after branch after branch, and this is how you could take the wooden wheel over the laid down corduroy road, if you can imagine what that looks like.
I can.
And then you have different stone type roads 4,000 years ago. And then you have different advancements for water drainage, okay? And the Romans, about 2,000 years ago, were able to come up with the Roman gladiator sandals. It's kind of fashionable for women to wear these types of sandals, but this is the first time that something was really solid and stable that goes underneath the foot and actually stabilizes the foot. And so the Roman army was able to put this rigid lever essentially under your foot, okay? So in your foot, you have 33 joints, okay? 14 of them are in your toes, which they're kind of like left over from gripping trees, and they're important. But the more interesting stabilizing joints, you have 19 of these joints from the hind foot to the midfoot. This is in your ankle, below your ankle, from your ankle to the ball of your foot. You have all these little, they kind of look like Legos, okay? Like little knee joints, little, ball and socket, semi-hemi, joints. And they're there, and they were developed to articulate on uneven ground. So if you ever go barefoot in the sand and you notice how your foot sloshes around and you really kind of are at the mercy of the ground, you have all these muscles. You have 8 muscles in your feet. You have about 28 muscles that originate at the knee, just above or just below the knee within a couple of inches, that insert into the foot. And you've got a total of 58 muscles around your hips that originate at the hips to stabilize the knee. Okay, so this is a lot of kind of like control mechanisms to stabilize yourself. You're really like a Jeep. Okay, you're like a 4x4 vehicle designed to walk on uneven surfaces.
Yeah.
So the invention, okay, and this has happened over 8 million years. Okay, walking upright bipedally. Okay, so put that into perspective.
8 million.
Okay, 8 million years. And just 6,000 years ago, we invented roads. And all of a sudden, the ground we've been walking on is really rigid and totally different. And it puts a different load at a cellular level onto all of our tissue, our bone tissue, the cartilage between our bones, the frequency that our muscles and our tendons need to stabilize us because we don't have this physical reaction from one tissue to the next that we've had for millions of years as animals. And, you know, that's a big change.
Yeah, and is it affecting then the way that we are evolving now, or the way that just the strength of our feet is now affecting our knees, our hips? Because you're right, I'll go to the beach and I'm like, oh, well, I'm going this way, I'm going this way, I'm going up, I'm going down. It's so hard to run on a beach, you know, and I'm there every day. And I pay attention to the way my feet are moving accordingly. But yeah, how's it affecting us now?
Well, it's interesting. Most of us in the civilized world are born and we're given socks and shoes. And you immediately in those early development years don't develop your feet like you could. It's kind of like a feral child.
Yeah.
Okay. And you're familiar with these feral children that don't have the, okay. So after a certain age, they just don't learn how to speak. Well, after a certain age, you kind of settle into who you are, and that's what you're dealing with. Okay, so some certain events like wearing shoes that are too small or playing certain sports, and you develop yourself and you're developing your phenotype, okay, which is the physical presentation of your body using the genetic code. So for instance, you were born to be totally symmetrical. Your code says both of us should be completely symmetrical, but do you have one arm that's stronger than the other?
Yeah, for sure.
Okay, so that is an example of phenotype. So you've developed a stronger strength due to the environmental loads that you've put on that side of the arm, if that makes sense. So by the time you're 11 and 12, you're really starting to mature into yourself. That's why braces for your teeth, did you have braces on your teeth? You got them probably when you were that age, 11 and 12. That's when the growth plates kind of come in. All these movements, all these activities, really at that age, all these elite athletes, they figured out that they were going to be elite athletes by that time, and then they pursue that for the next 10 years. And from 23 to 33, that's like the prime, where you see these elite athletes just doing really great, give or take. Some's higher, some a little bit lower. There's an estrogen which controls the blasts and the clasts for the bones, for instance, but essentially all the other tissue, where around 27 for females and around the age of 25 for males, you stop, your estrogen kind of starts to drop off, and you stop reproducing yourself and maturing yourself. So that's really kind of, I feel like, man, if you can really take advantage up until you're about 25 years old and kind of mold who you're going to be, that's where you're kind of setting yourself up to be that person for the next 75 years.
Yeah.
If that makes sense.
Yeah, like from a physical standpoint, correct?
Yeah, physical standpoint.
From physical. Yeah, which is why I always encourage people with young kids to have them be outside running around barefoot, just moving always in some capacity, because we just talked about like sedentary is the thing. That's like the new smoking, right? They're saying. So
totally.
And knock on wood for me, in my 20s, I was always working out, always running, always doing something, some sort of sport.
Yeah.
So knock on wood, that's laid down some good groundwork till I'm 90 years old or something like that.
Yeah.
But I think it's really interesting what you're saying. So are you suggesting then we take off our shoes as much as possible and walk on uneven surfaces daily, or what?
Well, I kind of got sidetracked a little bit, and I wanted to tell you a story about what you do, and with the barefoot, you go to the beach and you're walking barefoot. Not everyone lives by a beach, and they can do that, especially with temperature being a consideration. And I was in Hawaii, and I came across my friend Luan, Didn't know him, met him, good friend now. And he was born in Brazil, but he moved to Hawaii when he was 5. And he has never really worn shoes. And so I have these wonderful videos of him that are recorded running down this trail. Now, it's important to know that this trail was not graded. It was not a rock trail. Okay, so if you go to like a dirt road where they've brought in rocks that have been selected to be a certain size, okay, or you've come to a certain area where, if you were developed or you developed in your younger age where there was a lot of sand versus in England where there was not so much sand, it was hard bedrock and grass and things like that. You're going to really kind of adapt to whatever you were walking on between those ages up to your 13 and then really kind of like solidify and mature in your mid-20s. So here's Luan, and he's running down this trail completely barefoot, leaping. I mean, you wouldn't even believe, and I have this video in slow-mo, is he's just huge leaps running at the top speed downhill. Okay, so we're going down to the beach. And he's been doing this since he was 5. And here I am trying to do the same with my friends. We're just, there's no way we could even keep up with him.
No way.
Yeah, and so there's a lot of people out there who've been, walking around barefoot. I was just in South Africa. There were a lot of people walking around barefoot, and they can stand these very sharp ground surfaces, which most of us can't deal with at all. We just don't have the stability and weighing. We've developed with a brace on our feet, shoes. So, and in socks are another big deal. They scrunch our toes. It doesn't allow freedom for our toes to splay out at all.
Right.
Okay. So having a high heel, having shoes on from a young age, really limits these stabilizing muscles and kind of puts you into a smaller cone or a smaller area. And then your body ends up having overuse, injuries, and I see it all the time. I mean, this is in the orthopedic world, in the podiatry world, in the orthopedic surgeons world, or in our clinics, in the physical therapy clinics, dealing with musculoskeletal pathology, whether it's plantar fasciitis, metatarsalgia, runner's knee, hip replacements, knee replacements, different muscles being torn. Very often it's like an immediate, hey, we tore a tendon, or we had a sprain, we ruptured a ligament, okay? We've always been operating within this certain mechanical range of motion, okay? But now all of a sudden you've had this event where, let's go back to yoga, you've been operating, let's say you're running, you're playing basketball, and then all of a sudden you're doing a yoga class and you put yourself into a position that you have never really done before, and all of a sudden you pull something and you stretch that tissue beyond its stress limit. So this is an approach which is really, really great way to look at musculoskeletal pathology. We have a tissue stress approach. So whenever you go beyond the tissue's available stress limits, it fails, okay? Little tiny micro tears, okay? If that makes sense.
Yeah. Well, that does. And I'm starting to see the full picture now. It's really important for us. So really, take home is from a young age, if you have kids, get your kid out there barefoot, different uneven surfaces. Can we develop those muscles for us? I remember a guest of mine, Aaron Alexander, had mentioned to maybe put rocks under your desk at work and take off your shoes and just start stimulating those nerves.
Oh, I love
by
that.
touching those different surface rocks, some smooth, some rocky ones. Is there anything else that we can develop more to our true nature? Because that's what I want to bring people back to their true nature. Eating, moving, all these things are really important. Sleeping. Is there any suggestions that you can make for us how we can better ourselves?
Start slow is one, because you don't want to overexert yourself and do a movement that you're not used to. There's an old saying that, before you, I love this, but before you start an exercise program, consult with your doctor, okay? That, frankly, I think totally needs to be reversed. And I didn't come up with this, someone else says. Before you stop having an exercise program, consult your doctor.
No.
You really need to be moving all the time,
Right.
okay? So if you've been sedentary for a while and you've kind of got a fire inside of you that says, okay, I'm going to make a change in my life, just make sure you start slow and you listen to your body and you take it easy and don't compare yourself to anyone else,
Right.
okay? That's really the number one most important thing to do is just take it slow. Your friend who was on the show was talking about putting Aaron, who was putting rocks underneath the desk. That's so great. I mean, there's something called earthing, where you connect to the earth. You have the neuromuscular stimulation of the rocks. If you're doing this without any socks, that's great. Have it right up against your skin.
Yeah.
You can certainly walk barefoot, but it's important to understand when you walk barefoot, or like I'm in kind of a zero drop, an ultra shoe right now. We're not walking on bare ground. So have you seen a lot of this barefoot movement? You've talked to a lot of these barefoot type of people?
Yeah, 100%.
Yeah, so you have to be really careful, because if you take 5,000 steps a day or 10,000 steps a day barefoot on asphalt and concrete, or just, let's say you're just in your house for a day, and you work from home, or you're working in an office and you're able to walk around barefoot on concrete, that ground is not bare. You evolved over millions of years walking on varied terrain. So there's these great videos of the Aboriginals, and this was the British recording Aboriginals walking around and doing a documentary. I think it's 80 years ago. Don't quote me on that. More or less 80 years ago, maybe 100 years ago. Okay. And I was watching this, and I'm looking at the Aboriginals walk, and they are walking totally different. So you have that argument for, let's say, the runners out there. If you're a runner, it's like, oh, do you do ball striking first, or you come in with the heel contact, or is it a mid strike? Okay. I mean, in the running world, we just did a sub 2 hour marathon about 7 weeks ago, okay, in Vienna. That was a pretty interesting event. But the reality is that whether or not it's a ball striker or a heel striker depends on you. It depends on your shape, and it depends on the surface that you're walking on. So there's no right or wrong answer. The answer is yes. You can walk on all these different surfaces. You can walk all these different ways. A variety of movements is really important. Yeah. In the diet space, you hear now, a variety. Or I think I can't recall if it was your podcast or another podcast. It was is there a human species specific diet? Okay.
That wasn't mine.
Okay.
Yeah.
And the answer is there really isn't a species specific diet.
The answer is yes.
Yeah. I mean, it's what suits you best.
Right.
So trying different things and finding what suits you, what makes you feel good, what gives you the most happiness.
Right.
But getting out there and moving is really, really important.
Huge.
Yeah. And that's what it comes down to. I mean, sitting is the new smoking, of course. If you sit, you're not using your body. It was designed. At a cellular level, we need to be loading ourselves. When the astronauts go to the moon, they come back, they're totally atrophied. Okay. Totally atrophied.
It's crazy to see that.
Yeah. I was talking with one of the employees of SpaceX, worked very close with the CEO. And, they were saying, what the heck are we going to do? What are they thinking? We're going to go to Mars? We're going to occupy other planets? This is so far off there, because the body has spent 1 billion years adapting to this Earth, 9.8 meters squared, the acceleration of gravity. Take an astronaut, give him to the moon, you have all these problems. How are you going to create artificial gravity? I mean, it's just, maybe we could do it, but it seems very far off, even for the people that are very close to these entities that are trying to get to different planets and survive. Yeah. So the amount that we've evolved and how quickly we've changed our environment in the past 100 years, or even 6,000 years, just with the invention of roads, that's pretty significant. And I see it in my practice all the time. We see all these different pathologies. People that have all these pains. Professional athletes. I mean, the highest paid professional athletes in the United States or the world coming to see me, and they've got something that's going on because they're overusing something. They're using it the wrong way. They have financial pressure, family pressure, or they're putting pressure on themselves to perform. Or it's someone who's dealt with a pathology, they just want to walk again, okay, due to a car accident or due to a stroke or cerebral palsy, multiple sclerosis, all these things, to adapt to what's going on and to adapt to your environment.
Yeah, it's incredible stuff. So I think a big takeaway that I keep thinking about is how there's been 6 to 8 million years of evolution, and then in the very short term, we just threw all these monkey wrenches in there for our convenience, right? And it's made a lot of positive changes, but maybe it's affected the way we are interacting with our environment, right? And we're not evolving how we were. And getting back into nature and, getting that stimulus and that movement on the feet, right, is going to have overall effects in the whole body, not just, your knee down, right? It's a full body thing. We're just a big mechanical thing moving around with connecting gears, correct?
Totally. There was a patient that contacted me this week. She's a medical professor, she's a doctor as well. She was going to have surgery on her hips, and she wanted to do everything to avoid surgery. She had some other surgeries. She had Ehlers-Danlos syndrome, Ehlers-Danlos syndrome, or EDS, pretty popular situation. Basically, is a connective tissue disorder where you're very lax, okay, and very flexible. And she was going in to have surgery. That was the plan, but we looked at her mechanics and we saw there was some kind of in front of a mirror, and kind of looked, measuring the hips, measuring the shape of the femur, measuring the shape of the knee, measuring the shape of the tibia, the lower leg, the talus, which is this little ball that's in your ankle. Then you have your calcaneus, your heel bone. Okay, you've got your mid-tarsal joints, the navicular, the cuneiforms, the cuboids, your metatarsals, and your phalanges.
Back to anatomy.
Yeah, exactly. So all these things are relative, and the morphology and the shape of them is really unique. It's unique as faces.
Yeah.
Okay, and so sometimes you have this really weird anomaly where one little tiny shape is going to affect the next shape, is going to affect the next shape. So the body is like Jenga. So one little block out of place, and then go walk on it 10,000 steps a day, and all of a sudden you have a labrum tear.
I see.
Okay, so she's going in for reconstructive labrum surgery, and we look at her feet, and she's very loose, and she has to rely on her muscles. When you're ligamentally lax, the ligaments hold your bones together, okay, and the muscles control the bones, but you can substitute. When you have like really weak or very lax ligaments, the muscles will help stabilize from bone to bone and substitute ligaments. Sometimes the reverse happens. People rely on the ligaments, okay, and then pathology happens.
Right.
Okay, so when we took a careful look and we realized what was going on at the foot, it totally stopped the excessive wear on the hip joint.
Wow.
Okay, so with a slight adjustment in the way that she walked, a specific type of shoe and a specific type of orthotic, we were able to get her into a more comfortable situation, and her pain in her hip subsided. She didn't need to have surgery.
That's incredible. And she was about to get a full-blown surgery.
Yeah, just a labrum repair. Yeah, exactly. I mean,
that's just amazing to hear.
This goes for meniscus problems. This goes for tendon repairs. This goes for arthritis. Arthritis is when I was looking and learning this, it was arthritis. You can't repair it, and you need to have it cleaned up. We need to have a little surgery. We need to remove the bone spur. If it's really bad, we need to do a fusion of the joint if it's in the foot, and all these things, or a total knee replacement or a hip replacement. How many people do you know who've had
more than a few?
Okay, that have hip replacements, knee replacements. You're over 65.
Yeah.
The numbers are incredible.
Yeah.
Okay.
Yeah. It's pretty incredible. So to think that you could just make one small change in a person's foot, and it can affect upstream all that stuff.
Totally.
Amazing.
Totally. So, and even the other thing that's really fascinating to me is something I call cultural gait, okay? So if you and I were to go to New York, and we were to get off the plane, and we were to walk through JFK, we would look around, and we subconsciously would adjust our gait to be New Yorkers. They're beelining it.
Get out of here.
They're bent over. Well, are you from?
Yeah, I'm from New York.
You're from New York.
Yeah, did you hear that? Get out of here.
No, okay, all right. So you bend over a little bit more, just a degree. It's very subtle, but it's as subtle as going to Texas, and then the difference between Dallas and Houston, the accent and the voices. It's a cultural talk, and you talk around your people. You want to fit in.
Yeah.
We're Homo sapiens. We want to fit in.
Wow.
So you adjust your walk. Like here in Santa Monica, I walk across the crosswalk, and my hips are pushed forward. I'm looking at my cell phone. My shoulders are back, and I'm taking my time. Now, I'll get a New Yorker immediately here, and they want to run this person over in the crosswalk. But that's the culture here. That's the culture in LA. It's relaxed. You're taking your time.
Yeah.
If we got on a plane and went to Cairo, it's a totally different culture gait. They lift their knee much higher up, and they have like a step gait. They land with the ball of their foot first. When I was there in 2004 for the first time, I was 24. I was taking all these. I thought I was like a National Geographic guy with my camera, with my Kodak camera. Okay, and I was taking all these pictures. I go back and I look at them. The guy that I was with, and all these people I took pictures of are walking with this step gait.
Wow.
I've been there again and look around. Sure enough, this is the culture. So it's just like accents in our voice. You can adjust the way you walk. Now, for instance, there's something about walking straight. Okay, people want to walk with their feet straight. Or young girls nowadays, they look at models. Back in the day, the generation prior, models would stand with their feet. One was turned out. The shoulder was forward, the other shoulder back, one arm straight.
That you looked really 90s when you did that
Thanks,
pose.
appreciate that. Okay, check this out. Now, all the models, you see them, you go flip through one of these magazines. They're toed in. Their feet are toed in. Maybe I heard one of my patients say, oh, that's because we want to look slimmer. When you toe in, it makes you look slimmer. So now you go to the high school or you go to UCLA and you look around, you see how the girls are walking. They're mimicking what they see. It's a cultural gait. Now, let's say the shape of your hip doesn't work so well for you to be turned in, but you're forcing yourself to turn in because it looks better. All of a sudden, you've got some other link in the chain, whether it's your knee or your foot, that is getting worked harder and that fails eventually. So let's say one part of your knee is getting worked every step you take, that collision, that compression in the knee joint, okay? And then you're forcing rather than to use the full surface area, let's say you have 10 centimeters of surface area, okay? 10 centimeters squared, but you're only using 2 or 3 centimeters. You should be distributing that load across all 10 centimeters. If we didn't have hard ground, you'd be forced to use all these different centimeters every step you would take. You would be moving around. The load would come through your foot. The load would come down from your head, through your spine, to your pelvis, down your legs, down into the foot, and every step you take would be a little bit different. You've got this beautiful articulation, like a 4x4 vehicle, but we're walking on a racetrack, and we're doing the same exact movement over and over and over again. All of a sudden, arthritis.
And the incredible thing is cultural gait. Like you said, they made certain people, person to person, might not be made for that particular movement or adaptable like the other person. And then it's putting more pressure, boom, an injury.
There was a light bulb that went off when I saw these Aboriginals walking. One guy was walking like a duck, and he was standing like a duck. The guy next to him in this picture that was 100 years old was pigeon-toed in like this and walking pigeon-toed. They've never seen a mirror.
Wow.
They see all the variety of people walking different ways, and they don't have a celebrity saying, this is how you should walk. It's subconscious.
That was not their cultural gait. There was no influence.
People are just doing them to feel they're totally in a different state of mind.
That's interesting.
They're just doing them, okay? And they're not affected by a magazine, or they're not affected. That's such a new thing. There wasn't these Aboriginal, the indigenous people, I heard some wonderful thing where if you had an interest in being a leader, you were never a leader. The most humble guy is the one that was always elevated to being a leader in some of these indigenous tribes. So just one way of kind of looking at our culture, not having...
God, there's so many different factors more than just, what we're stepping on. There's just so much. We need another hour with you, but we got to cut it short because we already got an hour. So you got to come back.
Sounds good.
Let's do it in the summer. We'll get you back in here. And when you see me that time, we'll do it barefoot, the show. Right?
Okay, sounds good.
And all right, so where can the listeners or the viewers find you if they need to work with you or want to learn more or look at videos or something like that?
Yeah, sure. Our website is kevinorthopedic.com. We have an institute in Santa Monica. We also provide services to physicians from New York, Florida, all over the country, essentially, where we have, if you email us, hello@kevinorthopedic.com, we can help you find someone who will put you through a Biomechanical Intelligence exam. And so this is a very comprehensive exam that's conservative. It's not invasive. It's not, really, it's just a beautiful exam to figure out who you are and kind of look at the unveiling and look at your mechanics, how you stack up as a set of Jenga blocks, but your bones and your ligaments, your muscles, if that makes sense.
Amazing. So, and we can learn more about ourselves biomechanically. Awesome for athletes, but awesome just for the general population who want to be able to biomechanically be at their best.
It's all about longevity.
Yeah.
It's about the quality. It's not living longer, but it's having a very quality-filled life.
No pain, nothing like that.
Yeah, and life performance. That's what we're going for, a higher life performance.
Okay.
Yeah.
All right, man. Thank you for coming in, and I will be seeing you in the summer. We're already going to book you, and I appreciate this conversation, man. You're amazing.
You too, Christian.
Thank you. All right, what a great interview. I really, if you heard me quiet, it's because I was just taking it all in because it's so interesting to hear different perspectives on different things in life. And again, that's the type of people I'll bring in. People who give us perspectives that we ain't never heard of, but how we can apply those to our life. So really, really awesome interview. I'm glad that you all listen. I'm glad that you all rate. I'm glad that you all subscribe. I'm glad that you all tell your friends about it. Because of you, this show is growing. I love you all, and I'll see you next week.